So today we are with the incredible pregnant and popped partner, Danielle Barrett, the founder and expert women's and men's physio from PhysioMatters. Danielle is here today with her colleague Zan to talk all about a very common concern for pregnant and new mums, that unavoidable gap or separation of muscles we all experience with our ever-expanding pregnant bellies. So if you're worried about your mummy tummy, or you're here because you want to know how and why your abdominal muscles separate during pregnancy and what you can do about it, then you are in the right place. Danielle will cover the most up-to-date information, and I can't wait to get stuck in. I do need to cover a little bit of housekeeping. Something important I do have to say is that these masterclasses are designed to give evidence-based support and information to you. Nothing said or shown on any of these masterclasses should be deemed to be medical or legal advice. So always listen to your healthcare team and consider this to be complementary information to what you are hearing from your healthcare team. Super quick introduction about me. If you don't know me already, I am Kathy Rougier. Lots of people have come across me now through Pregnant and Popped, be that the Baby Fair for Mums or through the WhatsApp Village. The reason why I started all of this is because I'm a certified postpartum and infant care doula. So that means that I support mums in those early days, weeks, and months after having a baby with feeding support, physical and emotional recovery, sleep, and generally getting used to that transition through the fourth trimester and then that fifth trimester. What does life look like now that you're a mum? But today is not about me in any way, shape, or form. It's all about PhysioMatters and Danielle and Zan. What can I say about Danielle? Well, firstly, I think she knows that I say this, and if not, she does now. But I tell clients that Danielle is the godmother of physios here in Singapore. Not many people nowadays can say they truly love what they do, but I know that Danielle can. She has been supporting mums and dads for many years here in Singapore. She told me that she always knew she wanted to be a women's health physiotherapist early in her undergraduate studies, and that life's experiences, including being a mother of two and being a woman, undergoing all the wonderful changes that aging brings. She said that, by the way, not just me, has made her an incredibly well-rounded practitioner for every stage of our lives. She is an Australian, but has called Singapore her home for many, many years, over 30 in fact. She has worked in the public and private healthcare systems in Australia, UK, Canada, and Singapore. Her approach to her practice and life is keep it simple, functional, and fun. And I love it when she says, and she really does say this, let's bring the F words back into our daily vocab. Fabulously fun and fit. Have I got that right, Danielle? You will have seen that Danielle is here today with her colleague Zan. Zan recently joined PhysioMatters as part of the women's healthcare team and is specializing in women's health as well as children and teens. She spent several years working in the public health system here in Singapore with a lot of networking and connections. She is passionate about Pilates, which is now a fabulous addition to the services and support you can now get at PhysioMatters. And with that, I will stop sharing my screen and hand over to the wonderful team, Danielle and Zan at PhysioMatters, for an informative and fun masterclass.
Hi everyone, thanks for joining us today. Thank you, Kathy, for that fabulous introduction and the privilege of being part of Pregnancy and Popped and having Zan here with us today as well. I think Kathy's given us a great introduction and we're just going to jump straight into it on Mind the Gap and all you need to know about the abdominal separation, DRAM and more. If you've got any questions, if you can save them to the end, we'll do a Q&A. And if there really are burning ones that you've got to pop up now, you're welcome to. But it's always better at the end and then we can answer them. You might be answering someone else's question. Okay, so on our second slide, can we go second slide? Just press that. Yep. Well, Yep, there we go. So let's chat. So this is what we're going to cover in today. We're going to talk about DRAM, diastasis rectus abdominal separation. Have you got a DRAM? What may cause a DRAM? And how do we assess and treat you? We'll be really clear on that. And treatment options that are out there that both we offer and our colleagues offer out there as well, and supporting allied health professionals offer as well. Before we do that, though, Zan and I both felt it was really important just to put this little preempt in, as we really, there are several physios out there dabbling a little bit of women's health and say that they can assess DRAM and things like that. They can, but please always make sure, check their qualifications, check that they are registered with our registered body, the SPA, the Singapore Physiotherapy Association, and have undergone higher graduate training, because there's a lot more that you learn in that postgraduate training and with experience. And I don't want you to go and see a basic level physio who's not specialising in this area and things get missed. So just check those things out. Everyone's pretty much registered out there that are in the women's health side of things. We primarily treat as women's health professionals, backs, breasts, bellies and below, and that's our slogan here at PhysioMatters. And we can add to that Pilates, exam, paediatrics and teens as well. And that's the area that Zan will be expanding in her field. So we're going to talk about the core muscles. Where are they? What do they do and everything? I wish my six-pack tummy looked like that. Obviously, that's not me because I don't look like that. I'm working towards that. But just in principle, I'm going to stand up and step back. That six-pack that the picture is going to show you, we'll do it more extensively, is the rectus abdominis coming down here. That's a muscle that goes under the ribs to the pubic bone and allows you to bend forward and tilt your pelvis that way. We're then talking about the oblique muscles that come around like hands of a glove or going into the pockets of your trousers, high down to low, and they're the oblique muscles here. And there's an external and an internal, and they twist and each way left and right, and they side bend you as well. And deep underneath that, from the pubis bone around the pelvis, up under the rib bones and coming through here, is transverse abdominis, one of the main stabilizers of our back and the main supporter of this core floor. We also connect this later on to your pelvic floor. Now, and we'll talk about that later on as well, but those muscles are then covered with skin, fat and tissue, what we call fascia. It's like a glad wrap covering around them. And they join with a lovely thick zipper down the centre called the linea alba. I love this linea alba. When you see it, it's collagen, it's elasticated, and it allows us, just like a zipper, to peel out and grow out as we expand in pregnancy or change our fitness levels. And because of that reason, our bellies will all look slightly different as we grow and expand in pregnancy. We change through hormonal stages, and that's due to the beauty of the linea alba. It's really elasticated. When it's intact, it can come back relatively close to its original form. However, a few things do affect that. So let's have a look at this next picture. So ladies, if you've got a separation, it might be due to one of these configurations you'll see here. There are 5 little models up there. My pointer, I hope you can see my pointer there when I'm pointing. Yeah, that's great. So the most common that we will find is this one here, which is second from your left. That's in the separation of the DRAM area, usually in that first and second trimester. And part of the third trimester, we commonly see more of this one in number 3 here. Because the baby has dropped down into that lower area of the abdominal wall, and that gets wider as well. Overall, what we often find as ladies is they will present between a combination of this, and this usually looks finally like this last one here, where that whole central area will be separated in varying degrees. Now, if you have a look at this slide, if your belly looks anything like this, it's variations. These are just 3 common bellies that we would see. Sometimes there's a little bit of loose skin you can see on that middle slide. Thank you. You might have some stretch marks where the skin has stretched at a rapid pace, and that can be genetically related to and a number of other reasons. You may have a little herniated belly button too, as you'll see here, and you'll see in this one here. Different herniated belly buttons look quite different. Nothing much to worry about usually. They're usually cosmetic and don't often give you pain or discomfort. But the belly button is basically the remnants of the umbilical cord from our bellies connected to mum. It gets cut and then folds in and down a little bit. Now, when we need that extra space as our baby's growing, that area gets pushed out and forward. And we just term it herniation. And herniation is when the inside gets pushed forward outside, and it depends on the area where it is. So I don't usually worry too much about umbilical hernias, but they can put a bit of a barrier in place to us getting our DRAM closer together, and I can always assess that and show you that when you come into the clinic. But Zan and I use modalities such as ultrasound, which I'll talk about in a minute, to assess that area. Now, what causes this separation? I've touched on a few little pointers already, but primarily we group them together for you. Being pregnancy, being one, that might be the baby's in a Western baby, we class a heavier baby 4 kilos or more. In more of an Asian culture, I generally find, nothing documented, but clinically, about 3.2 shows us quite a significant stretch in most ladies of Asian build, because your pelvises are usually often smaller and tissue is slightly different. It might be the baby's position, they might be sitting quite high, they might be sitting low. It might be the fact that you've had 1, 2, 3, 4 pregnancies already, or you may have had twins or triplets. That'll change the appearance of the DRAM as well. Hormones play a huge part. Okay, pregnancy hormones, progesterone, relaxin, and they alter the connectivity, the stretchability of that linear alba and your skin in general. And as we get older too, we're losing estrogen rapidly. I know my DRAM is never apparent. I've entered menopause and I can see that estrogen changing myself and the skin is getting softer and looser. And I'm thinking, oh my God, this is what my patients have talked about for years. So I'm in that realm as well now. Now, looking at return to exercise, we want you to get back to exercise, but mums are usually super eager to get their bodies back into shape, and they often go back to shape too quickly. So let us guide you back into that. We recommend a minimum of 6 weeks to allow your uterus to shrink down inside before we get you back into a more solid exercise program. But that doesn't mean that you cannot exercise. You can do many other things in that 6 weeks as well, walking, swimming, bike, so it might be a variation. And that's where we as practitioners come in and guide you through that as well. So we don't want you basically returning to the incorrect exercise, returning to full hardcore boot camps using your tummy, boxing and rotational movements which put a lot of stretch on the DRAM and that separation. Not to say you can't do them or you won't ever be able to do them, it's just a timing as to when we bring them in. And that's really important. And that's our role as practitioners to guide you into that area at the right time. So what do? We look at the assessment and how we assess the DRAM, first of all, and you can see in that picture here, that DRAM looks quite deep and quite wide. We use real-time ultrasound imagery at our clinic. Some clinics have it, some don't. It pings, uses sound waves to generate a picture, and we can video that picture for you and have a look at your muscles and tissues in live action. I love real-time ultrasound, and it's the gold star of having a look at muscle activity. We can use calipers, which we have used for years, and I'll show you a picture of these, tape as well, and other modalities to check your DRAM separation. So if you look on this picture here, you've got your calipers, a little bit old-fashioned nowadays, but we still do use them very much. A tape measure can almost give us that same sort of width and diameter, but the gold star being up here in real-time ultrasound, and become portable versions now as well, which we will have in the clinic soon. Okay, so rather than getting on the floor to assess it, you've got that picture here, and we can always send you out a picture as well. But basically, if you're laying down on the floor or a mat, or on a mat, or on your bed, the floor is better because it's a lot more stable and you've got firmness underneath you. Take away the pillow so that your head is not in extension, and that will not affect your DRAM then. And then basically, have a look, identify your belly button. Place your fingers horizontally. So the biggest thing that I see with mums is they assess vertically. You can't assess a gap vertically, it has to be horizontally into the belly button. And then I like to say go maybe 2.5 cm above that area and then push in gently and feel. Lift your head off the pillow as you come up, and you'll see in my second picture there, and you can feel that DRAM separation if you've got one. It's a gripping feeling around your fingers. Now, as a non-clinician, you'll probably feel that gripping feeling. As a clinician and practitioner, we go for a checking of the depth of those muscles as well, the feeling of the tissues coming in, and look at a couple of other things as well that possibly a layman would not look at. So we recommend looking at just above the belly button, at the belly button level, and just below the belly button, about 2.5 cm. This is well documented on several YouTube videos and things like that. I think we'll show you a little bit in the clip later on, but it's nothing to sort of spend too much time focusing on. Really quite easy to assess a DRAM, but you've got to be accurate with it, and that's when experience comes in. So once again, that's me using the ultrasound, pain-free ladies, so don't worry about being in pain or discomfort, a little bit of cold gel on your belly and pubic range area for looking at the pelvic floor as well. It just uses ultrasound, as I mentioned, to bounce off water and give us an image and a picture. And this is what you'll see very, very clearly. And you can take a picture, we can keep a picture on record for you. So here we have over here, that is the linear alba separation in the middle there. We have a muscle here called the rectus abdominis six-pack on the right. We have one on the left, And basically we get your head to lift and close and see how that gap narrows and measures it. I then like to look at those three muscles that have created that gap: the external oblique, the internal oblique, and the transverse abdominis. The three muscles I mentioned to you in the beginning. And you'll always usually see a disparity between right and left, whether you're right or left-handed, and that's a normal natural disparity. We try and get them as evenly based together as we can in the right position, mainly the right thickness and the right strength as well. And that's where the exercises come into play as a women's health physio. Okay, we're going to show you a video now, just doing the real-time ultrasound. And you can see I'm 2.5 cm above the belly button. We go straight to the screen there. So we're looking above, below, and in the middle section. Right. Rectus abdominis here, left rectus abdominis here. There you go. Good shortening. Right. Remeasure that. You can see the shortening distance. There, 0.5 cm. You've got that lovely thickening of that right rectus and left rectus. Good outcome above and below the umbilicus. Okay, so that's just a brief introduction of what you will see. Now, there's no one-size-fits-all program. We might see similarities between people's exercises that they give, but we're all built differently. Some of our muscles are stronger and weaker than others. You've really just got to think of the core, whether you're working out as a physio in Pilates or in one of the exercises that you love doing, as made up, the core being made up rather, as the diaphragm at the top, okay, the pelvic floor at the bottom, and those muscles around and in between. I like to think of it as a canister, really. So if you don't breathe well, you'll find that you'll have issues with your pelvic floor because the pelvic floor and the diaphragm regulate pressure within the abdominal wall. If you don't have a good pelvic floor, you might have issues with breathing and all those other muscles working. So you've got to find that intra-abdominal pressure and that balance, and we're going to talk about that in a minute. So we want you to go from a mummy tummy to looking like this within 6 weeks to 3 months, really. Maybe not as flat as that. Let's be a little bit more reasonable. Perhaps there's been a little bit of work done here, I'm not sure. But we'll get you in line as close as we can to that and work on that option. Okay, so where do we begin? We begin with posture. So obviously when you're pregnant, your posture is a little bit different. I'm going to try and alter this slightly here and just show you, and I'm going to use Zan here as our model. Hopefully you can see here that. Okay. Hopefully you can hear. But when you look at posture, when you're pregnant, what often happens is the belly goes forward. Obviously you've got a baby growing here. You get a rounding lordosis in that lower back there. Knees get locked out for balance. Shoulders get back, and often the chin comes slightly forward. Zan is obviously not pregnant like that, okay? When you do that, the pelvis goes backwards and it loses intra-abdominal strength in the front to allow that belly to grow forward. So what we try and encourage after pregnancy or during pregnancy times is just to check in with yourself by unlocking the knees, just slightly unlocking them, trying to find your center of gravity with your pelvis again through your feet. You'll feel the tummy muscles will come into play a little bit and the chin will fall into a better position. So we're looking at maintaining basically on posture the three curves, cervical spine, thoracic and lumbar, so that they're not exaggerated in the pregnancy stage back and exaggerated in the lower area and the thoracic or the back. We take you back into that good area where your weight is evenly distributed under your feet, your knees are unlocked, pelvis is in a good position supporting your core and floor, and your pregnancy can maintain and grow well, and afterwards you regain that core education a lot quicker. So doing a little bit when you're pregnant on your posture really does help. And if you don't worry about it. We can look at the postural changes, and even just changing someone's posture dramatically, they say, wow, my DRAM is looking better. It actually narrows down and is a little bit more effective. So that's what we were saying in these next slides, just maintaining the three curves of your posture in a good, healthy way. So then this picture here, you'll just see we've gone from that lumbar exaggeration here, unlocking the knees here into this picture here. Baby stood sitting in a beautiful position, head down, ready to go. But doesn't that woman look so much better with her posture? She'll probably have less lower back pain. Delivery is likely to be better or supported in a better way. And just the overall maintaining the posture and recovery will be a lot better down the track. So look at always checking with your posture. Breathing's a huge, big issue. Whether we're stressed at work, we're stressed in a pregnancy, or stressed being a mother, we often tend to breathe in the upper parts of our lungs here, and we forget about the use of the diaphragm in this lower section through here. So nothing fancy. Just if you ever get time, place your hands around your rib cage. You can try this with me, and just think of breathing into those hands around the rib cage. Allow the ribs to expand and go backwards and come down naturally. Yeah. So trying to get that rib expansion, sending the air down to the base of the lung as your ribs expand outwards and come back in. Just checking in with your body and trying to do maybe 3 of those breath consecutive times. And once you can manage that breath really well, placing that in as part of your exercise program really does help. And also just acknowledging the fact that are you carrying tension up here as a mum in your breathing pattern? And if so, it's going to compromise how well your core and floor works. Okay? So now we'll just take a brief moment to talk about pelvic floor exercises. That's a huge, big topic in a nutshell on another time that we could do. I'd love to do at any point in time. But basically, you've all heard, I'm sure, about your pelvic floor. Here you've got your pelvis here, there. You've got your pelvic rim. The bladder sits in front, the uterus and ovaries here, and the back passage here. These are the pelvic floor muscles, these red slit-like muscles in the front, creating a hammock from the front to the back, coming around the vagina here, around the back passage here, and up to the back. So just think of the pelvic floor, just to break it down simply, as the floor of your core muscle, as a hammock that holds into your pelvic girdle area, that holds into that pelvic area, holding those organs up. The muscles can be worked in the same way, it's just the timing is a little bit different. So we have fast contractions and we have slow contractions. Just talking you briefly through that. I just want you to think about closing the back passage like the stocking wind or gas. Think about closing the front in front. So perhaps looking at the model here, closing the back passage like you're stocking wind or gas, closing the front like you're stocking a wee, and picture drawing those muscles up internally and inside, like a lift or an elevator. So you're closing the back of the elevator, you're closing the front, and you're drawing those muscles up, holding for 2 to 3 seconds, and then relaxing them down. That's in a very basic nutshell a Kegels or a pelvic floor exercise. Now, Kegels are pelvic floor exercises. It was Dr. Kegel in 1942 that founded the pelvic floor, and that's where we take the terminology from. So a quick contraction, as I said, up for 2 or 3, down for 2 or 3, and we should be able to do 10 in a row in any position as we build up over time. And you can do that same contraction and just hold it a little bit longer, 10 seconds or so, relax it, and that's called a slow contraction. And that's building more endurance muscle fibers. We need to work both so that we don't end up with leakage and other pelvic floor problems, but the pelvic floor is the basis of where we build that core and floor from and start to close down that drain. Okay, so having a look on the ultrasound, you'll see here on the left of the screen, relaxed pelvic floor left and right. Sorry, right and left, it's reverse on the screen. You've got your bladder here, and you've got the pelvic floor muscles in between here. When you do a contract on the real-time ultrasound, you literally see left and right contract and lift up the bladder, and you can see if someone is doing them correctly or incorrectly. We have another video which we will play. That's it. There is no sound on the video, so I'm going to talk briefly. There you'll see the bladder. You'll see the pelvic floor lift up, and you'll see the pelvic floor relax. Lifting up there and relaxing. And that's a really clear picture. So ladies, when you come in and see us for a pelvic floor or core assessment, please do so with a full bladder, as comfortably full as you can, because we need the water in the bladder area for the sound waves to bounce off and give us a picture. A lot of ladies come in and go to the toilet just before seeing us, and that means we have to see you another time to have a look at that area. So please don't waste that opportunity. So now I'm going to hand over to Zan, who's going to talk about how can a physiotherapist help you with your brand.
Thanks, Adele. Hello. Hi, everyone. All right. So now you must have been wondering, how can physios help with your brand, right? So I'm just going to run through a few pointers and things that we do essentially that would be expected during your session. So to start out with, we teach awareness of the core. We teach you what exactly the core is, and also towards that, we build on your core strength as well. And very typically, I find a lot of my clients with DRAM is that they have low back pain, they have pelvic pain, and these are common issues that are associated with a weak core, as we found out with DRAM. So we teach them pain relief. We have our teaching release techniques that we can do to relieve the tension in the tense areas of the back or the pelvis. We also use braces and we use tapes for support. And these things I just run through these things with you later. So what are your core muscles? Simply put, these are the muscles of the abdomen over here. So it attaches all around you from the back, attaches to the spine, your pelvis, and back, so it kind of wraps around the core over here. But when we talk about activating your core, it's very important to focus on the activation of the transversus abdominis over here. Over here, and also of the internal and the external obliques. And these are the muscles that we need to focus on, because those are the deeper muscles of the core that are going to be helpful in closing your DRAM. So, and with that, let's practice. So, before I go on, I just want to make a disclaimer: I don't perform any of these exercises if you have any, abdominal or back surgery, or if not get by a doctor to do so. And to most importantly, stop if you experience pain. So we do need to locate our core muscles first. So how do we do that? Typically, I will recommend lying facing upwards, such as the lady over here in the picture, the slide down to your knees. Okay, so I'm just going to show myself in standing. Place the border of your hands this way and the hips. I'm just going to bring your fingers downwards towards the umbilical region. So the border of your hands here will be where your transversus abdominis is, and the palm and your fingers here will be the bottom of the palm here will be where your obliques are. Your fingers here will be where your transversus abdominis is. Okay, and that's how you locate your core muscles. So I'm going to keep those fingers, and keep your hands there as we go on. So moving on to activation of the core. Here's a picture, drawing in of your umbilical button, the belly button. So breathe in, and on the breath out, you're drawing the umbilical button downwards towards the spine. Okay, what you should be feeling, if you're doing it correctly, is that in-drawing of your abdomen. So you should feel your fingers kind of sinking in just a little bit. What you shouldn't be feeling is, if you start to push upwards. So you should never ever feel like a doming pressure, so like upward push of the abdomen. This is what we call doming. And we wouldn't recommend never ever do this, especially if you have a DRAM, okay? Because it's going to increase the pressure around the abdomen area. It's going to make it worse. Right, so just be very careful when you're starting to do all these exercises by yourself. So that's one. So another thing to note is also the rise of the chest. So when you are activating your core, making sure you're not holding your breath, your chest is not sticking out, because that is what we call a compensation mechanism, and we don't want that to happen to you. Right, so no breath holding, minimizing any chest movement, and no doming. So the visual image of how doming looks like, for those who don't know, it'll be the picture over here. So you can see like a rise, like a bump in the center of your abdomen, and that's where the pressure builds up. And that's when your core you're actually not activating your core at all. So for those who are able to activate your core, then you can try to add a pelvic floor lift. Okay, so you kind of close the back passage, close the front passage, and then you lift up your core. Okay, so bringing us through a couple of the exercises that we can do to strengthen our core, and the basis of this is to actually build a good core control and be able to incorporate this into the daily activities. But before we can achieve that, we need to get some form of strength, some form of control in the controlled environment first. So now I'm going to do a quick demonstration. So this is what we call the single leg slide. Okay, so you find the mat, you can lie down. Okay, and you can put your hands around the abdomen area just to feel the core. Right, so you're going to start by activating your core first. So drawing in that belly button down the spine. Okay, and let's bring that away. So for those who find it too difficult, you can start. We all start with the feet flat on the ground, thighs flat, calves on the ground as well. And now keeping the core in, you're going to bring this slide the leg up towards the pelvis. Okay, so the main aim for this is to do it slow, nice, and controlled. Okay, don't do it too quickly because you're not going to lose the connection to your core. Right? So if this is too easy for you, move your legs slightly above the ground. You can slowly drag it in. You know, for any compensations. So for example, your pelvis starts to move side to side. If you start to do, you start to feel a lot of outward pressure from the abdomen because that's a sign that your core is not getting activated. And you should never ever breath hold as well. And progression of these exercises will be, to do it in a breathing position where you can have a ball in between your knees. I can just show you one right now here. Right? So, you can do the hip abduction exercise. So putting a ball in between your knees over here. And think of squeezing the ball in between the knees with nice and even press. Right? So ball in between the knees. Nice and controlled. And you're gonna keep the ball straight ahead in the center, okay? Just gonna squeeze at the same time, breathing out, activating the core, drawing in the belly button towards the spine. And relax. One more time, so on your breath out. And squeeze the ball, breathing out through the mouth, blowing air out. And breathe. Right, so that's one hip abduction. Right, so we always need to level up our exercises. So like a step up from those on the ground would be if it's to change the surface, change it to like a more dynamic surface, something that moves, for example. And what we have here is a fit ball. So for those who have, we can sit on a fit ball. For those who don't have, we can just sit on the sofa and sit on the chairs. Two weights. So you can just use any weight. So if you're starting off light, you always start off light. 1 kg or 0.5 kg and weight that you can handle. For those who don't have weights, you can consider using bands like exercise bands, resistance bands as well. For those with absolutely no equipment, don't worry, you can use water bottles. Okay, so we're going to do our bicep curls. Okay, so before that, we're going to check your posture. So everything that we now covered earlier on. So making sure you are back flat, the chest is engaged, and your neck is now pushed back. So everything is nice and upright. And most importantly, making sure your core is strong in it. Alright, so now resting your hands side to side, making that little breathe out. And bring the weights up towards the shoulders. Breathing in and still release the weights down. The important thing is control. Keep making sure nothing is moving. The ball is stationary. You are not trying to go into a compensatory movement pattern like this. Okay? You're not straight. You're not rotating. The ball isn't rotating and it's not moving. Because when we talk about core, it's all about control. Getting things right. It's always important to start off slow, keep the movement low as well. But also, we can do a different variation of these exercises. You can do the presses, chest presses, just kind of pushing the feet upwards and away from you. Control, making sure both hands are moving equally at the same time. Minimal movement of each ball. Okay? Bring your hands to the side, up and down. For those who want a little bit on the object, you can take for example, I'm going to use my right hand, bring my right hand to the neck. And then you can come down up this. Okay. When we find it easier to do with the right hand, on the bend, or you can do it with the weights. So this rotational movement here works on your pockets. You can choose to keep the elbows extended. You can choose to bend it. Bending it is always easier, so you can start with that first. Yep, and those are the ones that I've gone through, so you can alternate between TheraBands, weights, water bottles, anything that you're comfortable with. So the only question now is how often do you need to do these exercises? Recommended, do it on a daily basis, 10 repetitions, 3 sets. So this is the minimum amount of load that your muscles need to rebuild. Basically, if you are to do something that's too easy for our muscles, it's not going to bring out any improvement. The muscles are just going to stay as how they are. We need to overload the muscles in a nice and controlled manner so that the muscle fibers rebuild to become stronger. And more importantly, building muscles takes time. So really be patient. Science tells us that we need a minimum of 4 weeks of consistent exercises, consistent follow-up for significant changes to be felt. So don't get too discouraged if everything feels the same after 1 to 2 days if it's perfectly normal. Happens to everyone. So how else can we help in closing your DRAM? We have Pilates. We do pre and post in the Pilates as well. Well, Pilates is great because it's a low impact activity that helps you to really engage the core, teaches you on core awareness, posture awareness, and body awareness, and it challenges your body to move in a very dynamic manner while engaging the core at the same time. And the core work that you learn from Pilates can actually translate to your day-to-day living, such that in standing, when you're carrying a baby, when you're kind of walking around the shopping mall, so that you're aware of your core, you're aware of your posture. We also do the electrical stimulation of core muscles on e-spin constructs. So what we do is that we have the electropads that kind of go onto your abdominal muscles, and these electropads, they transmit a low frequency electric current that helps to activate the muscle so you can kind of feel a stronger contraction. Besides that, we also have supports, so just what this video is going to show you. So this was the tape that I was referring to earlier. Here we use a kinesiology tape. Important for the tape to be. So this tape here has a bit of like a pull to it, has elasticity to it. So it's important not to use the rigid tapes because then it's not going to give you much support. Right. So ideally, we place the tape around the abdomen, okay, so that it kind of mimics the movement of your core muscles activating. And this is going to essentially support your core as it becomes stronger. So that's one option. Now, the next option would be a brace, which I'm going to show you in just a short moment. Right, so that's how we do the tapes. Yeah, so this is the brace over here. So we have to so this is what I call the DRAM concept. So as you can see from video here, it kind of wraps around the core, wraps around the abdomen, giving a good support. For those who need slightly more support, maybe for example, if the DRAM is quite significant, we would use like a lumbar brace. So the difference between a lumbar brace and a DRAM concept is that the lumbar brace here, it has the metal, kind of like the metal stick that supports. And that can provide you with more support. Okay, so these are the things that we have in-house, and usually we would assess the situation and see which kind of brace, which form of support suits the best for you. So taping being the one of these support, all the way to a lumbar corset, that will be of the most support. And the main aim here is to keep your core nice and supported, reduce any symptoms related to DRAM, for example, back pain, pelvis pain, as the muscle gets stronger. So what are the additional treatment options for closing your DRAM? Surgery. Surgery is to only be considered as a last resort. Very often the surgical procedure that they'll be undergoing is abdominoplasty, which is many of us may know as the tummy tuck. And most importantly, it's important to engage in post-operative management by physiotherapists and a surgeon. So what we do here in physio is that we activate the core, we continue core muscle activation and strengthening pre and post-operation. And we do work very closely with our surgeons to do that. So what is science telling us about surgery? Good news is that surgery together with physiotherapy has been shown to improve your low back pain and urinary incontinence, and to overall improve the quality of life also. And these symptoms, these improvements, are actually reported within 1 to 3 years post surgery, which then suggests that surgery is actually a possible permanent that surgery can provide a possible permanent functional improvement in all areas. Right? And yeah, so with that, we've come to the end of our sharing.
Wow, guys, that was so much information. Thank you so much. There was a question that I often see actually in the pregnant and popped village, in and around the use of the balls, the balls to sit on for pregnancy and exercise. And it was, does it matter what size ball we sit on? And, should it be heavily pumped up? Should it be nice and soft and squidgy? What would be your recommendation on that?
That's a good question, Kathy, and it does pop up a lot, and we should really make sure that the ball matches you in terms of your height and your weight. So basically, a standard rule of thumb is that when you sit on a ball, if you see my hand here, you think of this as your bottom, and this is your knees and your feet here, and we've got a ball underneath here. When you sit on a ball, you should be at 90 to 110 degrees comfortable. So your bottom should not be down here on the ball. Your bottom should not be up here on the ball. You should be 90 to 110 degrees with your knees bent and feet flat on the floor.
Okay.
Most monkeys between about 5'2", that's about 163, to about 5'5", 5'6", that's about 170. We'll be on a 75 cm ball. And if we just show you, and just on a ball, on a good ball, so I would always make sure we only ever stock American or Canadian balls. But because there are some copies in Asia and the latex might not be as good, you never want to be on a ball that's too soft and too rubbery and too bouncy in case the latex, particularly over the heat in Singapore, gets lighter and thinner. So if you look on a ball, I hope you can see that, you'll see a 75. So on your ball, check the marking 75. So they go 55, 65, and 75. Most women are a 65 or a 75 cm ball. When you sit on the ball too, there should be about a 10 to 15% give on the ball, a small little give. It shouldn't be soft and squishy. There should be just like a nice resilient bounce. Like, you can see that just that slight movement. So if you were to sit on the ball and bounce with your baby, rocking them or bouncing them, there's just a give, release, give, release. There shouldn't be a down, up, down, up. The ball is too soft if that happens, okay? So watch out for that. You don't want the ball excessively hard. You don't want it excessively soft either.
Super information. I mean, that is literally the questions, that we get asked all the time, really succinctly. So
Good.
Thank you for that.
You're welcome.
I do have another question for you. Wondering what point postpartum should we start DRAM or pelvic floor exercises?
Great question. Thank you, whoever brought that up. Look, you can start pelvic floor exercises within hours post-surgery. It just depends on your surgeon. If you've had an episiotomy or tear, your surgeon might ask you to wait 1 or 2 weeks and allow that tissue and the collagen fibers to tighten up a little bit. But most surgeons will say, oh, start them when you're ready and comfortable. So we'd recommend often, within 24 to 48 hours, starting a pelvic floor. And that's where it's great to come in when you're pregnant and know exactly that you're doing your pelvic floor correctly. So if you know that you're doing it correctly, then post-surgery or post having your baby rather, your doctor will usually give the clearance and the tick off within 24 to 48 hours, and you can start your pelvic floor contractions. There should be no pain, no discomfort, or no excessive bleeding at all when you're doing your pelvic floor exercising if you're doing in the postpartum period. Now, when do you start the DRAM exercises? Well, we used to primarily ask clients to come in at around 6 weeks when the uterus was going down in size. So it takes 6 to 8 weeks within that range for the uterus to shrink in size. And the reason being is you don't want the uterus blocking the abdominal wall and giving us a false reading on the abdominal wall. Now we're actually looking at asking clients to come in around the 3-week mark post-delivering their babies or post-surgery, because we can check on your breathing, we can check on your pelvic floor at that stage, and we can start to activate your core muscles. So I often like ladies to come in around that 3 weeks mark, or come in even sooner if they're in pain or discomfort with any part of their body post-delivery and or post-surgery. And then we really start core activation of those muscles a lot more succinctly from that 6 weeks onwards. Okay? But pre-delivery or pre-surgery is always even better to start all of the above, because post-surgery, post-delivery, you can get on with it, within that time frame and know what you're doing.
That's really helpful. Thank you.
And I guess with a real-time ultrasound, the beauty is that you don't have to do a vaginal exam and internal, because a lot of ladies don't want to have anyone prodding or poking around that area after you've had a baby. I totally get it. I've got kids as well. So the real-time ultrasound can teach you sort of 70 to 80% of what you need to know. It can't tell us the strength of your pelvic floor. It can't identify a prolapse and a few other things which we can back up with an internal, but it does give you the choice to have either or nothing sort of in terms of the investigation. So really encourage you at any stage of your lives, ladies. 1 in 3 ladies have issues with their pelvic floor, 1 in 5 guys, and the number is increasing yearly as the stats go in some fashion. So please come in and check your pelvic floor if you're worried in whatever way you might, have any concerns come in. Thank you, Kathy and Pregnancy and Pop team, for allowing us the opportunity for us to talk about areas that we're both really passionate about and really want to grow further in Singapore. If you have any questions on today and you haven't wanted to ask them, or they pop up in your mind later on, often I, think back, go, oh, I wish I'd asked that, and oh, I forgot to say that, Please just text us, go onto our Instagram, ask us personally. We'll get back to you within 24 hours for sure, or come in and contact us in another way. All the details are there, our website's there, and otherwise, Kathy, you can always direct them our way too.
Absolutely. And that just leaves me to say a huge thank you to Danielle and Zan. Thank you so much for your expertise. And as always, a massive thank you to everyone at home watching and listening. You're the people that make this happen. Without you guys logging in, we wouldn't be doing this and able to share this information. So a big thank you to everyone. And I really look forward to seeing you all at the next Pregnant and Popped Masterclass. Bye, everyone.
Thank you for the opportunity. Have a great day, everyone. Bye.